And then we go along to things like, gastric balloons. And we have a really good product at the moment, something called the Elipse Balloon, which is a little capsule, which here's one I made earlier.
You've got one there.
I've got one here, not for personal use, I hasten to add, but it's a little capsule like that. I hold it up beside me. So
it looks a bit like a tampon, I'm sorry to say, but it does.
I wouldn't know. So you swallow this little thing, and the tube hangs out of your mouth, so it sticks out the side there.
Wow.
And then I connect it up to a bag of fluid, pump it full of fluid, and then magically it becomes this in your stomach. So it's about the size of a grapefruit, and it has a special valve on it, which after about 4 months, the fluid inside is water with a special additive which degrades the valve pops, the balloon packs down to virtually nothing, and you pass it out in your motions naturally. So it's a very simple, non-invasive way of helping people lose weight, because obviously that in your stomach takes up a bit of room.
Right, so it takes up a lot of space in your stomach. Yeah. So you can eat just a couple of things and you'll feel really full. So
you feel full, but what we've also learnt is that because it's sitting there in your stomach, so here's a stomach.
Yeah.
I've got all the props. I've got all the props.
Not yours.
Yeah, I'm a real pro, me. So this sits in the stomach, and that's actually the size of a roughly normal stomach. So that will fill it really full and stretch it a bit. And it presses on this area of the stomach, which is where it sends a message up to your brain saying, you're full, stop eating. And so people don't feel so hungry when they've got a balloon in the stomach.
Right.
It also slows down the stomach emptying, so any food you do eat sits there for a bit longer, and so you just don't feel like the next meal. You're not sitting there going, oh, I only ate a little bit 10 minutes ago, I think I need to go and have some more. So we find this is a really useful way of doing it. It lasts for 4 months in the stomach, and to be fair, this is a very clever piece of kit, the stomach. After 3 or 4 months, it knows the balloon is there, it knows what it's doing, and it does its best to try and, forget about it. So most people who have a balloon say that, yeah, after about 5-6 months, it wasn't doing anything because I just felt back to normal because my stomach had got used to it.
Right.
So that's why we do these 4-month ones, because that's about as long as you need to actually achieve something. But again, the most important thing about having a balloon is that you need the aftercare and the guidance to use it properly. In other words, just having a balloon will make you unwell for a few days because your stomach doesn't like it, and then you'll lose weight for 2 or 3 weeks. But unless you've had the dietetic guidance of, okay, let's use this feelings of fullness and lack of hunger to cut out the crap in your diet, no alcohol for a bit, and let's get your weight down. So we use this to its best advantage, and then carry that on after 4 months when this thing has passed out of the system. And that sort of methodology, that program of care, gets much, much better results. And we have patients who lose 3 full stone over a 6-month period with the assistance of a balloon. So we've got injections and balloons, and then we move on to stuff.
Can you get this on the NHS?
Not yet. You can get balloons, but they tend to be the older ones that you have to do an endoscopy to put it in and an endoscopy to take it out. They work in exactly the same way, but that balloon is at the moment difficult to do because we can't do endoscopies because of the COVID issue. But the NHS will do ballooning. It's just not approved this one yet because I think they know that if they approve it, like the Saxenda injection, if they approve that, there will be a long queue at most GP surgeries saying, I want the treatment,
I want
please.
it. What's really interesting about that, though, is like, it feels like, which in my mind is how you would want to lose weight. So you have the restriction, but in that time, surely it will teach you, hopefully, with the app, because you said that the app because I remember you talking about this before, that the app actually helps you to make the right lifestyle choices, and then you have, because it's linked up to a scale, isn't it? And the scale will give you information, and then you've got a care team that if you fall a little bit kind of off the wagon, they kind of
they come and find you.
They come and find you. Go, oi!
We'll send around Miss
Get the carrot.
Yeah.
So it feels like a care package, rather than
right. I mentioned before, it's a program of care. So basically, if you have an Elipse balloon, it comes with, you know, dietetic advice, and the dietitians that we have are absolutely fantastic. You know, hi Nicole, hi Heidi, and they will help prepare people for the balloon and actually guide them through, well, look, once you start with the balloon, this is how we're going to go on. And it's individualized. Not everyone likes the same foods. Not everyone's given the same diet sheet. It's about what works for you. But it comes also with this, what we call a linked scale. So there's an Elipse app, which you link to your weighing scales, and every day you get on and it plots your progress. And if your progress isn't good, it tells us, and we send around Miss Chiplash. So
yeah.
It's a very good way of helping incentivize people and keeping people focused on, you know, you've had the balloon, you've paid for it, let's get the best out of it for you.
And can I just say, I think this thing about motivation and incentivization is fundamental.